All right, we're going to be talking about epinephrine this morning. And so, again, epi is one of our big drugs. Again, it's a staple in cardiac arrest. It's kind of funny. We don't actually want to use it unless we have somebody in cardiac arrest, and then when we go to somebody actually dies, that is our go-to drug. And it's not a safe drug to give to somebody with a pulse, and we'll talk about that just a little bit. So, again, this is kind of our standard, the dose, the packaging that it comes in. And most of the time, guys, this is the preparation that we're going to be using. But understand also there's different concentrations. To give you an example, this is a 1 milliliter, but this is 1 milligram. It's a 1 to 1,000 solution, which means 1 milliliter equals to 1 milligram. Versus this one right here, again, there's 10 milliliters in this preparation, but again, it has 1 milligram in it. So make sure that you understand, again, 1 to 10,000, 1 to 1,000. And again, a lot of times you're going to see the multi-dose vial, but this is 1 to 1,000. Again, really good to use in a muscle, intramuscular injection, sub-Q injection. This here is your IV. Matter of fact, there's actually a third preparation, which is called 1 to 100,000, where they actually take 1 cc of this solution, mix it with 9 cc's of normal saline, and then you get 1 to 100,000. They'll do this in something called a bump dose or a push dose of epinephrine. They'll do this on for certain situations. Now, again, epinephrine or adrenaline, as is also known. Again, adrenaline is normally made in our body in the adrenal glands, and it's kind of important for us. It's a survival mechanism. Again, it causes a lot of good things. It causes the blood to shunt into our central system. It increases our heart rate, which therefore increases cardiac output. It makes the heart squeeze not only faster, but it also makes it stronger. The other thing that it really does is it causes us to bronchodilate. Again, for that fight or flight reaction, again, think about when you get scared. You breathe deeper, you breathe faster, your heart beats faster. The blood kind of goes away from your skin, you get goosebumps on your skin. Well, if we give this medication, all of these things are going to happen. So again, this is one of my favorite ones here. If you give me epinephrine, my heart races. Well, guess what? Yeah, you're correct. It's not a side effect. It's not a contraindication. It's not an allergy. It is actually, that's what it's supposed to do. So, a couple of uses. Again, cardiac arrest is one thing we use it for. A severe asthmatic or having respiratory distress due to bronchospasm. If they're having a bronchospasm, they're wheezing really bad, or worse yet, they're not wheezing at all because they're not moving air. Epinephrine is used to open these people up. Again, it's used again during hypersensitivity. If they're having an allergic reaction, this is kind of our go-to drug. So again, it also releases serum sickness, angioneuroedema, and it also can actually be used for relaxation of the uterine muscle. Epinephrine actually does reduce blood flow to the smooth muscle areas. So again, so it's a sympathomimetic, which means it simulates the sympathetic nervous system. And again, it has an adrenergic agent, and it mimics the natural release of our own adrenaline. It's also sometimes called it's a class of drug, catecholamine, which means it helps with the act of a hormone or a neurotransmitter. So again, it is a naturally occurring one. It has both alpha and beta properties. Again, your alpha system is to vasoconstrict you. The beta adrenergic is what will bronchodilate you. Again, because it has alpha and beta combinations, one of the cool things that it does, again, is it prepares us for that fight or flight syndrome. Think about the bad part that would happen if someone was actually having a heart attack. So it does increase myocardial oxygen consumption, and it increases the irritability of the heart. In a cardiac arrest, when the heart is really dying, we want to stimulate that. That's why it's kind of our go-to drug in epinephrine. Again, when we give this, it's less than 2 minutes IVP for the onset of action. It's probably a little bit faster with that. If we're giving it sub-Q or IM, somewhere between the 3 to 10 minute out. Again, it usually lasts for around 5 to 10 minutes, okay? It usually lasts, the duration of that, especially when we give it a cardiac arrest, it's something that would really be important, especially when we get the patient back. Some of the things that you're going to expect to see is tachycardia. It's a natural reaction, and again, that will wear off in somewhere around the 5 to 10 minute mark. So again, we use it for asthma, for really bad, severe bronchospasms, for allergic reactions, and then VFib, pulseless arrest. Anybody that is dead, anybody that's a pulseless arrest, Epi is our go-to drug. So again, the side effects of this thing, it's how it works. The way that it works, again, you're going to get, if you give somebody epinephrine, their heart is going to race. They're going to get a little bit nauseous. Again, this is what the medicine, the hormone itself is designed to do. It's supposed to take blood away from the non-critical systems and take it to critical save your life body systems. So all of these things are going to be side effects. You can get some pulmonary edema with this because, again, you dilate out those the alveoli. You're reducing the size because you're trying to get more air into your body. So when do we not use this? And that's kind of the important part. If they are already tachycardic, probably not the thing to do. Let's fix the tachycardia first. If they're hypovolemic, no matter how much, if we don't have enough volume in there, we're not going to get any blood back. So we got to make sure that they have good volume in there as well. So again, any type of pulmonary edema, any type of heart problems, you might want to be really careful that you stay away from that. Again, but if they are in cardiac arrest, if they are having an anaphylactic reaction, there are no contraindications for this drug. You need to give that drug. Beta blockers do inhibit. Again, remember, it's a beta agonist. It works. So if they're on a beta blocker, it's going to work against the epinephrine. Isoproterenol and epinephrine, both of them speed up the heart really bad, and you really don't want to have that happen. And again, may be deactivated by any type of alkaline solution. When you mix sodium bicarb or calcium chloride with Epi, you get these lovely crystals. So make sure that before you give a dose of these, make sure you flush your lines very well, or give it in another line. Again, if they are digitoxic, you give epinephrine, they're going to really start throwing PVCs on you. They're really going to start throwing the funny little beats. And MAOIs or tricyclic antidepressants, it will prolong the effects of epinephrine. Again, do not use prefilled syringes with Epi infusions. You want to mix that with a 1 to 1,000 solution and not the 1 to 10,000. Again, syncope, if you give it to an asthmatic kid, it can actually cause them to pass out. And make sure to keep this out of the light. It will deactivate your epinephrine. Guys, epinephrine increases workload of the heart. So if they are having a heart attack, you really want to use this drug sparingly. Now, when the heart stops, that's a whole different story. But if they're actually having a heart attack, we want to really be careful with our epinephrine use. Again, the older the patient, again, for kids, epinephrine is a wonderful drug. For older patients, again, you're going to cause more workload to the heart when you give epinephrine. So be really careful when you're giving that, folks. And again, high doses of epinephrine can cause bronchoconstriction, and we're talking somewhere around the 5 to 10 milligram mark is when they start having bronchoconstriction with that. Again, many types of preparations that they have with that. We kind of went over that a little bit earlier. But again, so our adult dose for asthma is usually 3 to 5, 0.3 to 0.5 of sub-Q, and we repeat in 5 to 20 minutes. If they're nearing or imminent of cardiac arrest, you can actually give it IV. If you're going to give it IV to a patient with a pulse, very, very slowly, you need to give it slow. So when in cardiac arrest, again, that's when we're going to give a standard push 1 milligram every 3 to 5 minutes. That's our if you're going to be giving it in an infusion, we usually mix 1 milligram and 250, and that gives us a concentration of 4 micrograms per milliliter. We usually give 2 to 10. We started out at 2 mics, and we titrate it to the effect of whether our heart rate or blood pressure we're trying to get to. And again, asthma, we're going to usually, it kind of depends on the patient. 0.01 milligrams per kilogram is usually what we give it for the kids. Again, safe drug to use in kids. I can't stress that enough. And then, again, we can give this IV, we can give it IO, sub-Q, an IM auto injector, which is also known as an EpiPen. And for pregnancy class, again, not sure. It may cause a little bit of fetal damage, and so therefore it is a pregnancy class of C. But usually, if you're giving it to somebody that is pregnant, they have a severe problem going on. All right, well, that's epinephrine, guys. Again, it's a staple drug, so definitely a top shelf drug. We need to know this one backwards and forwards. Make sure that you understand epinephrine completely. And we'll see you next time.